when you look at 5-year survivals, and that's a metric that most organization use to determine prostate cancer aggressiveness. Prostate cancer, even in some of the advanced stages, still has nearly 100% 5-year survival. And that's different than the perspective of someone having pancreatic cancer or brain cancer, where the 5-year survival's not even 15% at times. So, I do counsel patients based on that and tell them, to put things in perspective. I encourage all my patients to make long-term plans still and to have a positive outlook, because the dynamic is also, the landscape of prostate cancer treatment is also changing, and it's a dynamic process. So currently, the American Urologic Association supports screening for men at average risk between the ages of 55 and 69. And then prior to 55, it should really be a shared decision and discussion based on risk factors. So what are those risk factors? So men with a family history of prostate cancer. A significant family history would be a first-degree relative, such as a father or brother with prostate cancer, or a more distant relative, but at least 2 affected distant relatives with prostate cancer. And then any other strong family history of hereditary colon, breast cancers, as well as prostate, of course, should be considered in a younger age group. So between 40 and 55 is that high-risk group that we need to kind of screen for if there's a strong family history or race. African-American men should also be considered to be screened earlier, under 55. So symptoms such as blood in the urine, painful urination, inability to urinate, or pain in the hips and spine. Those can all be very advanced presentations of prostate cancer. So that's exactly the reason why we screen men actively in the specific age groups, because there are no symptoms whatsoever.